far as the full spectrum of psychiatry in general, I mean, we see everything across the board. I mean, personality disorders, primary thought and mood disorders, depression, anxiety, PTSD. We see a lot of different things. If you want to go to a program that prepares you for every single possibility of what you could face after residency, then it would be here. Couple of reasons why I ended up choosing JPS. Number one, I wanted to be able to go to a program that had the full scope of the spectrum of psychiatry, where I was going to be super prepared after leaving residency and could handle and treat anything.
Truly, in looking at all the different psychiatry programs that are available here, particularly in Texas, because I wanted to stay kind of, local with my family, JPS had a very robust availability of things that I wanted to look into, the type of patient population that I wanted to work with. And JPS was just like a perfect fit.
We are a community and research center. So we're a community program first. We kind of mentioned that we help a lot of people in need here in our beautiful Fort Worth community, but that doesn't mean that we don't have a strong academic background.
The broad aspect of patient care, pathology, and experiences here. Our patients come in from a variety of different socioeconomic backgrounds, races, religions, ethnicities, family structures, as well as with a number of different pathologies, and they're at different places in their disease pathology. At times it's first break, at times it's well-controlled disease processes, at times it's decompensated chronic processes. So we get to see a large aspect of care.
With John Peter Smith, it is a county hospital, and so we serve a lot of the community here in Tarrant County that otherwise wouldn't be able to get care if it wasn't for JPS's services. With that, we have a lot of wide range of disorders, a wide range of patient experiences, patient life experiences that really can contribute with my training in terms of being able to make a diagnosis that's accurate, while also being able to kind of connect and learn about different cultures, different types of individuals with different backgrounds, socioeconomic statuses. We have a Psychiatric Emergency Center here. We see people that the police bring in with various types of illnesses, various types of substance-induced psychiatric presentations, and also with family members that come into that 24-hour lobby in the front and say, hey, I don't really know what's going on with my kid, but I think we need some help.
We have the second busiest psychiatric ER in the entire country. And so with that volume and the amount of diversity that we have here in the DFW area, and specifically here at JPS, you get a broad swath of diversity, tons of volume, and so you have no choice but to become well-versed in managing a whole, vast array of psychiatric emergencies.
You have to have a lot of heart to work here. There are a lot of patients who need a lot of love and support and affection because they're struggling with a lot of things not only related to their psychiatric care. They're struggling in regards to finances, transportation difficulties, socioeconomic status, difficulties with the law and with their families. And you have to be able to provide very well-rounded care for these patients, looking at various different aspects of their person, not just their psychiatric issues. And I think that gives us a good starting point for becoming very holistic providers later down the line.
When the residents first get here, they're usually paired off with either a senior resident to kind of help guide them through the process of integrating into what psychiatry looks like, how to balance the educational needs of psychiatry versus being a clinician that's independent practicing. And then we have check-ins for those residents with a actually faculty mentor. So they get paired off with a faculty mentor and kind of get feedback in terms of what they think they need to do to improve upon as being an adept clinician.
We have a lot of different opportunities to engage in administrative roles and leadership roles such as chair positions, chief positions, and working one-on-one with administrators for a month during fourth year, all of which to make you into a more well-rounded physician and more ready to go into the workforce whenever we do have to apply for jobs after residency.
I just want to say that with John Peter Smith Psychiatry, because of that culture that we have that is very, meeting the resident where they're at, supporting each other from all levels, from the residents supporting each other, the chief supporting the residents, the directors, and all the faculty members, I felt very safe.
The biggest reason to come to JPS is by the time you leave, you can practice anything in any setting, anywhere in the country. You will be sought after, it will give you leverage for your first job out, and you will be scared of nothing. Not a lot of places can promise that by the time their graduates can leave. But I can tell you, any clinical setting, you'll be confident, competent, and comfortable in training in that setting.
Get ready to have fun, get ready to be challenged, but also supported, and yeah, to become the best psychiatrist you can.